So whenever a patient is undergoing a surgery under GA, even normal person needs extra steroids. Even a normal person needs extra steroids. Okay, so whenever you're going for surgery, the anesthetist will give you a pre-operative hydrocort, an intraoperative hydrocort, a post-operative, say Dexa, something like that, dexamethasone, so that generally the patient is comfortable. So obviously, when a normal patient needs steroids under GA, a patient with secondary adrenal insufficiency will definitely need steroids under GA. Okay, so based on all these facts, there are certain protocols. The protocols are divided between universities that, okay, AIIMS says I am going to follow this protocol. Mayo says I am going to follow this protocol. Or the protocol is divided based on the type of surgery. So cardiac surgeries, this is the protocol. Dental surgeries, this is the protocol. So the protocols are divided. I am going to tell you the basics so that you are able to answer the questions. This is the basic protocol that we use in dentistry. Okay. When you are doing routine dentistry, what is routine dentistry? Scaling, polishing, root canal treatment, fillings, small procedures, primary teeth, something like that. Even for a primary adrenal insufficiency, you need no extra steroids. For secondary adrenal insufficiency, that is exogenous steroids, definitely you don't need any steroids. Okay. Secondary AI, just to remind you again, this is the patient who is taking exogenous steroids. Okay. For minor surgeries, now what are minor surgeries? Simple tooth extraction, primary teeth extractions, frenectomy, mucocele. Again, for a patient of secondary AI, only the daily therapeutic dose is enough. You don't need any supplementation of steroid. For moderate surgeries also, it is enough. For major surgeries also, the recommendation says that it is enough. Do only what you have to do for a normal patient. The original dose should not be increased. Okay? For a patient of secondary AI, the normal daily dose should be the same. Rest, treat the patient as per the type of surgery. So, what is this asterisk saying? The guidelines are based on patient's AI status. However, the requirement could increase if the patient health is poor, fever, fear, anxiety, infection, fever, cirrhosis, major surgery, general anesthesia. Okay, in these conditions, even a normal person will need exogenous steroids or extra steroids in surgery. Okay, so the original dose, the original daily dose of the patient needs no modification, for any procedure in a secondary AI patient. The same is confirmed with the Miller article, which is a landmark article that we read, the Little and Follis book that we read, which is there, and it says that only two are the concerns in a patient with AI. Okay. In patient with secondary AI, we have only two concerns. First concern is the HPA axis suppression, which is minimal, which doesn't happen on a patient who is only on a glucocorticoid replacement. Okay. Second is decrease in immunity. So you have to give some little bit of more antibiotics, a little bit of more precautions to infection, because these are the only two problems that will happen in a secondary AI, which is also minimal. Okay, so like it said, negligible risk, no supplementation required. Okay, mild risk category like few simple extractions, biopsy, minor periodontal surgery. The glucocorticoid target is about 25 mg of hydrocortisone equivalent, which is the same as the table that we saw, 25 mg hydrocort or 5 mg prednisolone on the day of surgery. This is usually what the patient is taking. So depending on the question that is asked to you, you have to answer. And if it is a moderate to major risk category, that is multiple extractions, one full quadrant periodontal surgery, extraction of bony impactions, osseous surgery, cancer surgery, any major surgeries, In that case, you have to give the same glucocorticoid target which we give in any normal patient also. Okay, 50 to 100 milligram per day of hydrocortisone equivalent at the day of surgery, and for at least 1 or 2 post-operative days also, because of the pain of surgery you will go. So there is nothing different that you will do in a patient. You will give him his daily dose of steroid plus this regimen which we follow in all the patients. Okay, now we come to some Australian and New Zealand recommendations, some recommendations from other universities also. So they are saying that if the steroid dose is small, 7.5 milligram prednisolone, okay, because इन्हीं tables में से सारे questions आएंगे. 7.5 mg prednisolone, which is 1.5 times the normal body production of cortisol. Okay, for GA or LA, both you don't need any supplementation. Okay, same thing is said by University of Otago. If you are taking more than 7.5 mg prednisolone, again, just for LA procedures, you can double it on the day of surgery. Okay, if it's a major surgery, you can double it on the day of surgery if you are taking a high dose steroid and if it is a major surgery. Okay, and of course, if it is a GA surgery, you will do the same thing, 100 mg hydrocortisone equivalent and maintain the usual dose. So those usual doses not changed. Okay, yes, it does recommend that double the dose just on the day of surgery so that the additional stress can be tackled. Okay, basic recommendation is you don't have to change the daily therapeutic dose, but some university says that कोई नुकसान नहीं है अगर आप एक double dose दे देते हो तो. Okay, and again Australian also says is just double the dose on the day of surgery, and for GA the same protocol. If the patient is taking very high dose of prednisolone, again it says that for minor surgical procedures no supplementation is required. Okay, and appropriate major surgery के अंदर whatever we are doing we have to do. Alright, so this is the protocol that we have to follow.